If you doubt that there's a connection between nutritional deficiency and depression, here's a chart of nutritional deficiency and its symptoms. In this column there's a list of nutrients, and you can see it's quite extensive. In the last column, here are some of the symptoms. I'm going to use the basic built-in browser search to look for incidences of depression, and straight away you can see up here that there are 11 incidences. Let's look through them. The first one is highlighted here, and it is calcium. If I click the down arrow, you see the next one, which is copper, iron, niacin, pantothenic acid or vitamin B5, potassium, pyridoxine or vitamin B6, riboflavin, vitamin B12, vitamin C, and zinc. Now let's repeat that. We've just found 11 instances of depression. Let's look for anxiety. Two incidences here: chromium and magnesium. Now I'm going to look for some associated symptoms, and the first one I'm going to look at is fatigue. We have 12 incidences. We'll go through this backwards because it's kind of started in the middle. Pantothenic acid, B5, potassium, pyridoxine, vitamin A, vitamin B12, zinc, chromium, copper, folic acid, iodine, iron, and niacin again. Let's go back up to the top and look for insomnia, which one might associate. And there are 8 incidences, and we'll run through, and it's the usual suspects. Another problem associated with lack of nutrients that you may not have associated with the problem is loss of appetite. So in fact, getting short of nutrients means you lose your appetite, so you're not taking in nutrients. Let's run through these. Folic acid, niacin again, pyridoxine again, thiamine, zinc. 5 incidences of loss of appetite being associated with low levels of nutrition. Now there's another angle to this. If you're not eating well, you lose your appetite. But how about your digestive system? 2 incidences here: selenium and thiamine. Both cause digestive problems, so you may not be absorbing the nutrients that you need. And with selenium, here's a note: the average diet contains 50% of recommended daily average. And if you look through some of these other ones, 71% and 90% of female diets are deficient in pyridoxine, which is vitamin B6. Magnesium, 75 to 85% of diets are deficient. Diet contains 50 to 60% of RDA, so 3/4 of us are only getting half the magnesium we should be getting, and you can see we need that. Folic acid, average diet contains 60%. Deficient in 100% of elderly. Deficient in 48% of adolescent girls. Requirement doubles in pregnancy. Chromium, 90% of diets are deficient. Copper, 75% of diets deficient. Average diet contains 50%. Calcium, average diet contains 40 to 50%. So that's just a quick overview of how nutrition affects specifically depression, anxiety, fatigue, insomnia, loss of appetite, mental impairment, and digestion. So I think it's fair to draw some conclusions that most of us need to improve the quality of our diet, perhaps take a multivitamin, and avoid things that deplete nutrients. And I'd like to show you some of these in the next set of slides. Now, from public domain information like the ones we've just been looking at, I put together a list of nutrients to go with my book, Understand and Overcome Depression, and some of the deficiency symptoms associated with these. If we look down the left column, these are the nutrients like calcium, copper, iron, etc. On the next column, the vitamin name in blue, and then some specific notes, such as you'll see that cobalamin prevents brain atrophy. Now that's helpful, and we'll explain more about that in the book itself. The next column is two columns, one in both in green, that this nutrient is needed for production of serotonin, which is the brain's happy hormone. It also helps rebalance the brain. There's another column in green which is this helps fight stress, and as we know, stress is the biggest problem that's going to help push us over the edge into depression. So there's half a dozen or so nutrients that specifically help fight stress and the effects of stress. Next we have about 8 columns in red, and these tick off boxes where these specific nutrients have an impact by their lack on depression, anxiety, insomnia, fatigue, digestion, loss of appetite, even paranoia and nervousness and irritability. And these are all things I would associate with depression or mental illness, and things that you really want to avoid if you can. So you want to get some nutrients into your system. Now, about depleting nutrients, if you look at this little next column in black, which is a fuel tank running on empty, you see there are some things that are depleting minerals, and specific minerals and nutrients. There's caffeine, alcohol, smoking, some antibiotics, and sugar. And these 4 keep recurring: caffeine, alcohol, smoking, and sugar. And if it looks like, if you read down that column, if one don't get you, then the other one will. There's only a couple of things that are not directly depleted by one or other of these 4 horsemen of the apocalypse. Next to that is a column explaining how much percentage of the population is deficient, and if I know the RDA, I've put it in this table. So I hope this will help. I hope you'll look up some nutrients and find out how to get them from your diet or take a multivitamin. Thank you for watching this video. I hope you found it helpful. You can get more information at my website, www.nutrition-vs-depression.com. That's nutrition versus depression.